Rachel, I'm going to check in with you. Can you see it? Awesome. Okay, so we're going to talk a little bit about how Cologuard can help whatever health system that you work for, whether it's a small little clinic out in the middle of nowhere, maybe it's a whole gang of clinics or an FQHC. But we're going to dive into that a little bit and we'll get started. So, went a little far. So before we get started talking about colon cancer, we just want to make sure to discuss some of the things that you shouldn't do with Cologuard, right? Since we're talking about Cologuard today, we want to make sure that we're just not using it for high-risk individuals, anyone who has a direct first-degree relative family history, someone who has Crohn's, colitis, maybe active bleeding, or some type of symptomatic issue, that they should always head directly to a colonoscopy. So, okay. So why are we here today? Why is there multiple options in colon cancer screening, right? Well, the real reason is because colon cancer is a massive issue within the cancer space in our society. You'll see on the screen that it's the third most diagnosed cancer out there and the second leading cancer killer, right behind lung cancer. You can see that about 53,000 patients get colon cancer every year. We're getting it at a younger and younger age. And you can see that about 50,000 people die every year of colon cancer. What this really means is that of the 53,000 new cases, we're not screening them early enough to find polyps, right? We're actually letting the polyp progress into a cancer, and then we're finding it, whether it's symptomatic or we're doing some sort of late screening and finding cancer, right? The true goal of colon cancer screening is to find the polyp and remove it before it turns to cancer. So unfortunately, that also leads to the 53,000 deaths that we experience annually because people find their cancer late, whether they're symptomatic, they've been avoiding colon cancer screening, and then they get diagnosed. So just as a shout out here at the bottom, you have a 6.5 times survival rate if you get diagnosed at early stage versus late stage. So screening is dramatically important. All right, we'll move on. Okay, a little bit of a picture of a colon and a little bit about the survivability of colon cancer. So on the left-hand side, or at least my left-hand side, you'll see an illustration of a colon here. We always want to find any changes within your colon health at a stage 0, also known as a polyp, right? I would assume most people on the line know that the goal is to detect polyps and remove them before it turns to cancer. That's the ultimate goal. The second goal would be to find colon cancer at an early stage, what we consider stage 1 or 2, or maybe early stage 3. And that rolls us right into this 5-year survival rate chart that you see on your right-hand side. So if you do get diagnosed with colon cancer because we missed the polyp or you weren't screened and it was able to progress, you have a 91% chance of survival rate if you have stage 1 or 2 of colon cancer, right? So you can truly have colon cancer, a stage colon cancer, and if we catch it early enough, you can have a great chance of survival. Even at stage 3, you can get a 73% survivability rate. But you can see that if you get stage 4, where it kind of breaks through the colon wall and starts spreading throughout the body, it really falls off at about 14%. So this slide is merely here to show everyone on the call today how important it is to find colon cancer at an early stage, because we have the tools and technology to do a great job at treating it. But the longer that you avoid and let something go, if you get diagnosed at a later stage, your chances of a 5-year survival rate are relatively slim. Okay, so I would assume that most people have heard, or at least rumblings, of our communities getting diagnosed with colon cancer earlier. We're going to talk about what the new recommendations are here in a second, but I want to step back and give you all a snapshot of really what's going on with colon cancer and why we're getting diagnosed early and what we're doing to change it. So you can see on the screen 51 and 52. So the American Cancer Society did a study 20 years from 1994 to 2014. And what they found is there's a 51% increase in colon cancer in younger people, right? Younger than 55 years of age. In addition to that, when those patients get diagnosed when they're under 50, 52% later stage than the patients that are over 50. And this is just because as a society, we're getting diagnosed or we're getting colon cancer earlier, before that kind of magical 50 years that most of us are used to. So, why is this happening? Maybe sedentary lifestyle, maybe diet, exercise. We're not exactly sure. But what we do know definitively is we're getting colon cancer earlier. And if we get it at a younger age and then get diagnosed, it has a high likelihood of being an advanced stage as opposed to if you were diagnosed over 50. Okay. So, the other thing is it affects everyone. Really, no one is immune to colon cancer. Some disease states affect dramatically more than others, but colon cancer is relatively clear across the board. I would assume that on this call, we probably have not as many Native American or Alaskans or maybe Asian Pacific Islanders, but definitely Hispanic, Latino, Black, and white populations. And you can see that the mortality and incidence rates kind of directly correlate. If you look at white or Caucasian, you can see that the mortality rate's about 40% of the incidence rate, right? In the ultimate scenario, we would drop the incidence rate because we're catching colon cancer at a polyp stage. And then in turn, that would drop the mortality rate. Or the other option would be if we get really good at screening and we find a bunch of early stage and they're very treatable, then we drop the mortality rate and the incidence rate maybe goes up, but we're really saving a lot of lives because we're catching colon cancer early in that stage 1 or 2. Okay, so we touched on this about a slide ago. And the new recommendation for anyone who doesn't know changed a few years ago. The new recommendation for colon cancer screening in all modalities is now 45 years old. That was the recommendation based on that 20-year study from the American Cancer Society. And you can see the major guideline organization, the United States Preventative Services Task Force, made that recommendation at 45 years old, maybe 2 or 3 years ago. So if you're not screening at 45 now, please let us know and we can talk a little bit more about that. Okay, so a little bit about colonoscopy. So before non-invasives took hold, like Cologuard or maybe a stool card or a FIT test, most people got screened for colon cancer with a colonoscopy. We know some of the challenges associated with colonoscopy, like the drive to and from the clinic. We also know the prep is sometimes a challenge. Some people don't like the thought of the procedure or the anesthesia associated with it. So what has happened is to get a colonoscopy, with the COVID pandemic and the national shortage of GIs and the barriers that we just talked about, if everyone that was eligible, the 60 million people in the United States, if we all decided to line up one day and then get colonoscopies, it would take all of us on average 10 years to get screened. That simply is just not gonna cut it, right? Colon cancer is on the rise. You saw it in the slides earlier. We have to use non-invasive testing to be able to get a handle on colon cancer and really make an impact. We can't just use colonoscopy alone because there's just simply not enough gastroenterologists to do the screenings, and there's just too many people that need to get screened. So, all right. Are we seeing anything in the chat? I can't see you guys, so I don't want to talk the whole time, but I want to make sure that we address any questions. Are we seeing anything out there, Rachel?
No, you look good to go, but let's maybe give anybody have
any questions
comments?
on anything we've discussed so far?
Okay, I think you're good to go.
All right, cool. So here's the ultimate goal, right? If you approach colon cancer in a variety of different ways, a systematic, overall improvement, what's the goal, right? You're gonna prevent cancer. That's that purple line at the top. If we screen as many people on time as we possibly can, and we hit a goal of 80% of the patient population that's eligible to be screened, and we get them screened on time, the assumption is that we'll reduce cancer diagnoses by 22% in the next 5 years by 2030. That's a huge number, right? We're literally going in, identifying a polyp, removing it before it turns to cancer, and avoiding cancer and the impact it makes on our family, our friends, and the people we surround ourselves with. Furthermore, if we do that, we reduce cancer, then we're going to reduce the deaths, right? We know that if you definitely screen, you're definitely going to reduce the number of cancers that are out there, and then that will reduce the overall deaths. And you can see it's over 200,000 by 2020 or 2030, right? Again, that's your friends, your family, relatives, anyone that would have to go through their cancer battle. We can reduce that by getting them screened on time. And then the cost, right? We know that screening is valuable. We know that it is far superior to treating. We want to be preventative in that. And studies show that by 2050, the healthcare system could save $14 billion if we reduce the number of incidents of colon cancer. So, all right, a little bit about Cologuard and a little bit about some of the other options that are out there. I would assume everyone on the call today might have used a Cologuard in the past or is currently using it. Maybe is using a fecal immunochemical test or a stool card, and is probably using some degree of colonoscopy. So we're going to talk about the different options. You can see some slides here, and it's really about patient preference, right? What are they going to do when offered, and actually get it done so that we can kind of cross them off our list as a screened patient. So I like to just jump right to the right-hand side where it says patient test preference, considering all the options that are currently available. You can see at the top, it's FIT, right? That's an annual test that you do. Then you move down the line to the Cologuard test, the stool DNA, and then colon video capsule. I don't know many people who do that, but it is an option on there. And then we roll down to the bottom with colonoscopy. So you can see here in this study, most people prefer the non-invasive option that Cologuard offers and the 3-year interval that it comes with. So that means you do a Cologuard once every 3 years. If it's negative, then you're good to go for 3 years. And that has proven to be the best option for both 50-plus-year-olds and 40 to 49-year-olds when they choose to do colon cancer screening. Okay, so a little bit about the Cologuard test, right? We know it's easy to do. We know you can do it at home, but how good of a test is it? So you can see here, the other prevalent colon cancer test that's non-invasive is what we call the FIT test, the fecal immunochemical test. And so in a 10,000 patient study that was published in the New England Journal of Medicine, we did a direct head-to-head against the FIT test to really give us a baseline of where we're at today. And you can see the Cologuard test is in the purple and the FIT test is in that teal color. And if you look at all stages of colon cancer, because the Cologuard uses specific DNA mutations as opposed to just blood like the FIT test, we have far superior sensitivity at detecting colon cancer. You can see in early stages 1 and 2, 90 and 100% sensitivity in stage 2. And then across the entire colon cancer staging platform, stages 1 through 4, we have a 92% sensitivity. Compared to FIT detected 3 times less colon cancers than the Cologuard in that 10,000 patient study. So just a little bit about where the Cologuard lands against another non-invasive option for colon cancer. But now we'll talk a little bit about the polyps, right? We talked about how important it is to find polyps or early stage colon cancer. So we want to also know how good is the Cologuard test versus the FIT test in finding those polyps before they actually turn to cancer. So again, you'll see here, Cologuard is in the purple, FIT test is in the teal, and the variety of different options or types of polyps that we look for when we're trying to detect a precancerous polyp. Again, you'll see similarities to the previous slide that across the board, the Cologuard test outperforms the FIT test. And that is in relation to the DNA mutations that we're looking for inside of your colon that the Cologuard detects outside of just blood that the FIT test detects. So, Rachel, how we doing out there? We got any questions?
So far, so good.
All right, cool. Just a few more slides. Um, so, when using the Cologuard test, what should the expectations for the provider or staff member or the patient be? This is how I like to look at this slide. So 84% of the time after Cologuard has done now 18 million tests, 84% of the time the Cologuard test will become negative. Okay. So when talking to patients and they're trying to understand a little bit more about Cologuard, there's a high likelihood that it's going to be negative for that patient population. And then they will be done screening for 3 years. And then you can go ahead and get 3 years worth of quality credit towards your colorectal cancer screening metrics. What does it look like when a patient gets a negative, right? The whole goal of screening is to get a negative result. So then that patient can then be done with their screening until the next interval. So we want the patients and the providers to be very confident in the results. And that leads us to this 99.94. So for any providers or staff on the line, if you do get a negative Cologuard, it is a 99.94 confidence that that patient isn't walking out of your clinic with colon cancer. So a very, very strong number, very high confidence that that patient is going to be good to go. On the other side, if they do get a positive, what is the likelihood that they have cancer? True stage 1 through 4 colon cancer. And that's going to be 3.7% chance. Also, a positive could reveal a polyp or, of course, a false positive. But it's a 3.7% chance that that positive will truly be a colon cancer. Okay, so a little bit more about the completion rates and what it results in when the patient gets a colonoscopy. So I'm assuming most people on the line know that once you do a Cologuard, if it is positive, you need to do a follow-up diagnostic colonoscopy. And what does that result in? Well, compared to the FIT test, when there's positives that are present, patients are twice as likely to follow up with a Cologuard positive and get their colonoscopy versus a FIT test, right? And then what happens is they have a faster follow-up colonoscopy. You can see the comparison there, 86 days versus 127 days on average, right? That leads us to believe that patients and providers are more confident in the results they get and what is actually happening inside the patient's colon. And we want to make sure to get those patients in for a colonoscopy as soon as possible so we can find out a little bit more what's going on and why the Cologuard test triggered positive. Okay, so a few more things on how we interact with the patient. We all know that non-invasive tests and invasive tests are challenging to get patients to do, right? What do we need to do to follow up with them? What do we need to do to encourage their testing? And we know that takes a lot of manpower on behalf of the clinic. So we've created a full patient navigation solution. And after all of the tests that we've performed, we see a 22% increase when we reach out to the patient. You guys might have, if ever anyone's ever done a Cologuard or talked to a patient who has, we see text messages going out to the patient as follow-up, right? They can reach out to us 24/7 in multiple languages. We send them snail mail. We call them. We do the encouragement for them in the touch points so that the staff and the resources at the clinic don't have to do that to try to get those patients screened. And then overall, when we ask patients after they've had their Cologuard how their experience was, we see an 8.8 out of 10 in overall satisfaction. So the patients truly are good with the Cologuard. They don't dislike the process. They're very happy with the choice they made and how they're going to get screened. Who can have access to the Cologuard? So currently across the country, we have 96% of the patients that are eligible to get screened have zero out of pocket, right? So we see this as absolutely fantastic coverage. We have a tremendous amount of patients that have 100% coverage. And most all patients are going to have access to the Cologuard at 45 years old, that new recommended screening age. Oh, I actually already shared this one. Patient satisfaction and this is provider satisfaction. I apologize. So overall, providers that have used Cologuards are happy with it, right? From the conversation with the patient in the room to the ordering to the resulting and to the metrics that they receive and the 3-year interval, providers have shown that they're very happy with how Cologuard works and how it impacts their patients in a positive way and their clinic in a positive way. All right. So many of you, or maybe none of you, might have heard some rumblings about our new test. Our new test is going to be called Cologuard Plus. The goal of the Cologuard Plus test was to increase the sensitivity and specificity of the Cologuard test. That's an amazing test in itself, but how can we make it even better? So a little bit of information on the Cologuard test. So you can see the very top line there compared to FIT in the purple. When we look at all stages of colon cancer, we have a now 95% sensitivity, up from 93. So we bumped up the sensitivity 2 points, which still is far superior than the FIT test. Furthermore, we want to make sure that we're doing an even better job at detecting those polyps so that we can actually remove them before the patient has a potential of that polyp turning into colon cancer. So you can see across the board, we've made increases in sensitivity at our polyp detection. And you can still see the teal, the FIT test, we're still far superior to that as an option for a non-invasive colon cancer screening test. And you guys have seen this slide before. You saw it about 5 or 6 slides ago. We've also seen an increase in all of the categories across the board. So now we're showing 87% of the time the test is negative. We're now showing we've increased from a 99.94 to a 99.98 negative predicted value. That's so close to 100, it's just missing it by a hair. And the percentage of patients that actually do get a positive has reduced to 3.2%. So what does this mean? Really what this means is the more Cologuard Plus tests you do, the less patients that are going to have a positive. And when those patients do get a positive, we have a better positive predicted value at 3.2%. Okay. We've made it to the last slide. I hope everyone's still on the line and maybe has thought about some questions. So overall, what's the goals here, right? We want to adhere to the guidelines, the United States Preventive Services Task Force, NCQA, and receive that 3 years worth of quality credit for any time a patient does a Cologuard, right? We want to improve our ability to detect colon cancer and polyps. Early stage colon cancer and polyps is the absolute must here. And with Cologuard, you can have a very high sensitivity and specificity for those early stage or polyps. We want to make sure the patient experience is wonderful. We want to offer them an at-home test that they can do so they don't have to get a colonoscopy. We want to make sure that we follow up with them, we answer their questions, and we remind them to get their screening done. And we want to make sure, lastly, that patients have access to the Cologuard test with no out-of-pocket. And that's at 96% of patients that have zero out-of-pocket across the country that are eligible to get screened. So I hope everyone learned something about colon cancer today. Hope they learned something a little bit about Cologuard. And then we'll roll into a video for anyone on the line that has maybe never seen a Cologuard. And then we'll go into, Rachel, hopefully some Q&A. So 1 second here. Rachel, can
So
you
your
still see my
healthcare
screen?
provider has ordered Cologuard for you and you've
Can you hear?
received the collection kit. That may sound complicated, but we're going to make it easy. Cologuard has no special prep or changes to diet or medication. Neat, right? We'll show you in a few simple steps. Collect your sample and ship it to the lab where it will be tested. You may receive a few phone calls from Exact Sciences laboratories to remind you to use Cologuard if you haven't already. Before we start, make sure you'll be able to ship your sample the same day or the next day after collection to allow enough delivery time. The lab must receive your sample within 4 days for successful testing. Are you ready? It's go time. Step 1. Check the expiration date on the box. If you're good, then unpack it. First, pull out your patient instruction guides and shipping instructions. Then unzip the plastic bag to take out the contents for collection. Leave the bag attached to the box. You'll need it to safely ship your sample back. As you unpack the box, take your time to check that you have your sample container, tube, bottle of preservative liquid, bracket, and sample labels. Have everything laid out? On to step 2. Now raise the toilet lid and seat. Unfold the bracket and place it on the toilet rim toward the back. Lower the seat onto the bracket. Can you see the opening? Okay. Unscrew the lid of the large container and slip the container in the bracket. Perfect. Step 3. Now it's time to do your thing. Sit on the toilet and have a bowel movement into the container. Be careful not to contaminate your sample. It's okay if a little bit of urine gets in the container. Your sample should be whatever is typical for you in terms of consistency and size, but should be no larger than the bottle of liquid preservative that comes with your kit. When you're done, stand up, lift the container from the bracket and place it on the counter. But leave the sample container open because there's still a few more steps before you're ready to ship. Step 4. Grab the small white tube. Yep, that's the one. Unscrew the cap and pull out the probe. Now scrape the surface of the sample until you cover the grooves on the probe. Put the probe back into the tube. Screw the cap closed completely. Now empty all of the preservative liquid from the bottle into the container. Anything left in the bottle? Step 5. Next, place the lid on the container. Screw it on straight and tight. Then trash or recycle the empty preservative liquid bottle in the toilet bracket. Congrats! See how easy that was? Step 6. Finally, before you pack your box, you need to label your samples. First, check your shipping label and take note of how your name and address are written. Then, using a ballpoint pen, clearly print your name, date of birth, and date and time of collection on the blank sample labels. Label your sample container like this. Then, carefully pack your box back up and ship it the same day or the next day after collection. Here's how to make that happen. Peel back this label and voila, you'll find a prepaid and pre-addressed return label. Now you can either drop off your sample at a UPS location or call UPS or Exact Sciences Laboratories Customer Care Center to schedule a contact-free pickup. Plan to collect your sample when you can get it back to UPS that same day or the next day. The lab must receive your sample as soon as possible to be tested successfully, so make sure a Sunday or a holiday will not delay your shipment. After you drop off or have your kit picked up, it will be shipped directly to our lab. You should hear from your healthcare provider in about 2 weeks with your result. It's that easy. Now, enjoy the rest of your day.
All right. Go ahead and X out of that. Go to here. Stop share.